Hello, my name is Zdraví and I am a Swiss Dental Academy educator. Today we will focus on the importance of maintaining good periodontal health and how it could impact systemic health. The relationship between periodontal health and systemic wellness is an increasingly recognized and researched area in dentistry and medicine. Scientific evidence has suggested that there is also bidirectional relationship between periodontal disease and several systemic diseases. Let us begin with the most common systemic diseases. A strong relationship exists between periodontal disease and cardiovascular diseases. Chronic inflammation of the gums may contribute to atherosclerosis and increase the risk of heart disease. Diabetes, a quite common condition that exists today, has a clear two-way relationship with periodontal disease. Individuals with diabetes are at a higher risk of developing periodontal disease, and periodontal disease can also make it more challenging for individuals with diabetes to control their blood sugar levels. Periodontal disease may contribute to respiratory problems. This is because bacteria that cause respiratory infections are also present in oral biofilm and places an individual at risk when aspirated. Pregnant women with periodontal disease may be at an increased risk of certain complications, such as preterm birth and low birth weight babies. In recent years, research has explored a potential association between periodontal disease and an increased risk of developing Alzheimer's disease, though more research is needed to establish a clear connection. In addition, chronic inflammatory conditions such as rheumatoid arthritis and autoimmune disorders may be influenced by the inflammatory response associated with periodontal disease. Did you know that patients with head and neck cancers have higher levels of gingival inflammation and poor oral health in comparison to patients with other types of cancer? The association between periodontal diseases and systemic diseases has been highlighted in the consensus report by the European Federation of Periodontology and the World Organization of National Colleges, Academies and Academic Associations of General Practitioners and Family Physicians in Europe 2023. The oral health extends beyond its traditional focus on teeth alone and encompasses a broader perspective, including oral epidemiology. It is important to recognize that systemic conditions are significantly influenced by oral health. The oral cavity is considered the window to general health, and one cannot stay healthy without good oral health. Implementing preventive strategies effectively slows down these well-known risks. Systemic diseases are correlated with periodontal disease, emphasizing the need for strong interdisciplinary collaboration. By addressing these factors and fostering cooperation among healthcare professionals, the management and prevention of periodontal disease could improve, ultimately enhancing the overall oral and systemic health of patients. The importance of prevention, therapy, and maintenance for lifelong oral health through the GBT protocol has been strengthened once again. Thank you for listening. Tune in to our next episode.